Almost 10% of the world's population is depressed. Society tells us depressed people are weak or heartbroken. But do we know what depression really is? What is depression? Depression is a serious mental health condition that affects how you feel, think, and act. Depression causes feelings of sadness and/or a loss of interest in activities you once enjoyed. Those who have been in depression often receive comments like, "Oh, snap out of it. You don't have anything to be depressed about," or "It's just in your head." Many times, depressed people themselves do not understand their condition and blame themselves for what they are feeling, thinking, and how they are acting. Depression is not as visible as other physical disorders. It's invisible, and so are its symptoms. Since depression affects your feelings, behavior, and thoughts, the symptoms are also related to: firstly, how do you feel? There is persistent anger, sadness, guilt, and hopelessness. Secondly, what do you think? There is low self-esteem, loss of interest, and suicidal ideations. Lastly, how do you behave? There is social withdrawal, change in appetite, low motivation, reduced energy, and poor sleep. Depression can happen to anyone, but people who are at high risk include people with a family history of depression, people with low self-esteem, high pessimism, and reduced self-worth, and people with a history of abuse, neglect, poverty, or violence. Fortunately, depression is treatable. Psychiatric medicine has developed so much over the years that people can now recover from various mental health conditions, including depression. Depression can be treated through various interventions like clinical drugs. Medicines like antidepressants and selective serotonin reuptake inhibitors, or SSRIs, have proven to significantly reduce depressive symptoms. Therapy. The therapeutic approach functions on replacing the negative thoughts with positive ones, and this can be achieved through therapies like cognitive behavioral therapy, or CBT, talk therapy, etc. Electroconvulsive therapy, or ECT, is generally used in severe cases of depression where the patient is given mild electric shocks under anesthesia. It is used only in those cases who do not respond well to other treatments. Depression is cyclic and can reoccur time and time. Therefore, understanding depression is very important for yourself and your loved ones. If you or someone you know is struggling with depression, try these 3 things. Number 1, talk about it. Number 2, encourage getting professional help. And number 3, provide or seek support. Remember, mental health conditions do not make you less of a person. Let's end this stigma by talking more and more about them. This brings us to the end of this video. We hope you learned something about depression today. Do share your thoughts in the comments below. Thanks for watching. Take care, stay safe, and don't forget to like, share, and subscribe.